Okay, this is the first lecture of the second section as we navigate through human anatomy. You have just taken at least the lecture exam and maybe the lab exam. So that's our first series. And you've got a kind of a feel for what we're going to emphasize. And the next series, exam 2, which is going to be next Tuesday and Wednesday, is going to be almost identical as far as emphasis is concerned. So if you didn't do well, learn from your mistakes, make your corrections, realize there's a lot of work involved, and move forward. Okay? If it's a study habit that you're lacking, get a hold of Sarah. She's our expert in that. If it's material content, get a hold of Brooke or myself, and we will explain it. Remember, I have office hours from 12 to 1. She has SI daily from 9 to 11, and she has tutoring on Tuesday and Thursday. Plus, we're always available online. I think that hopefully you have been able to reach us whenever you needed us. We've had a couple of problems when you came to us at 10 o'clock at night and then wanted an immediate response and didn't know how come you didn't get one, okay? We do also go to sleep, okay? If we're on, and usually one of us is on, we get back to you pretty quick. Sometimes we have to talk to each other before we get back to you because the question you're asking is a little complicated, okay? But anyway, I hope we're starting to move forward. And now we're gonna do the next topic, which is articulations. Articulations and joints are the same thing. So it just one word and the other word. They're both equal each other. And in common language, a joint is where two bones touch. So an articulation is where two bones meet. Got it? And we're going to go through that. And then after that one, I do bone to cartilage, or I'm sorry, the other way around, cartilage to bone. There's a lecture on that. And I think that's like chapter 6. And then we go to cardiovascular and blood and respiratory system and digestive system. And then next Tuesday, we have another lecture exam, okay? So hang in there. If you didn't do well on the exam or you didn't do as well as you thought you wanted to do on the exam, make your corrections, okay? Because the emphasis is gonna be just like it was on this one. Are we good? Again, if you didn't do well, then what you need to do is gather all the points you possibly can on the next 2 sections, and you'll still do very well in the exam. Okay, I mean the class. Okay, so here we go. Articulations. Okay, now remember, we always start with an outline, and I do bullets. So every bullet, after we do the outline, I'm going to talk about it in detail. Okay, but I'll give you some dialogue right now to kind of give you a heads up as far as what does that bullet mean under the outline. Okay, it says articulations, joints. Okay, we already know that articulation, another word for it is joint. Another word for a joint is articulations. Are we good? Now, joints are held together. No. Joints are classified in 2 ways. One is what holds them together. Okay? 2 is how much do they move. So 2 independent but also cross over ways of classifying joints. Now, as far as what holds them together, okay, we can have fibrous, which is your dense regular. We looked at that under the microscope, yeah, and that was tendons and ligaments. Okay, so if a ligament is what holds it together, it's called a fibrous joint. And we see that in different places all over the body. The other way it can do it is cartilage. So if cartilage holds the joint together, it's called a cartilaginous joint, okay? Now, this is still under structure. I forgot to tell you that. So the first 3 that I'm giving you are structure, and the other one is movement, okay? And we call the movement function. So what holds it together is called structure. The amount of movement is called function. Do you understand? Okay? I'm multitasking. Okay. The third type of structure, what holds it together, is called synovial. Synovial, think of it as a sock, a tube sock, not the little ankle socks, tube socks. And you cut off the foot. You have the part that goes up on your lower leg. Okay. If you take a bone here and take a bone here and put a sock across that and tie it off, you have a synovial joint. And those are the ones we think of most of the time. We think of our shoulder or our elbow or our wrist or our knee. Those are synovial joints. Got it? Okay. Now you see in black here, I put selected articulations in depth. Your articulation chapter 9, goes on for a long time. In fact, you'll realize that you'll see, remember when we did movements, flexion, extension, hyperextension, that kind of stuff? That came out of chapter 9. I'm going to hold you responsible for that on the second exam. Okay, but I'm not going to go into dialogue on it because you've already had it. Okay, so once again, movements, planes, you remember, sagittal, frontal, coronal, that kind of stuff. Those you're going to get. I'm going to test you on it again on lecture exam number 2. I'll refer to it here in this chapter, but I'm not going to go into dialogue because you already have it. Got it? So what I'm going to do in this chapter is I'm going to talk about what holds a joint together, what kind of cartilage is around it, yada, yada, yada. And then after that, I'll go into I'll go into the TMJ, and you'll see ligaments, tendons, articular cartilage. You'll see a whole bunch of stuff in there. And that's what's involved in the joints. So if you're going to be a physical therapist, you're going to need to know that part of the chapter like your name. Okay? If you're going to go into nursing or psych tech or something like that, you're probably not going to need to know it. So therefore, if you're going to go into physical therapy, you're going to have that in an upper division class. So what I'm trying to tell you is I'll show you and explain you on TMJ, but I have them all in there on the PowerPoint, but you're not going to be responsible for it. I'm just giving you a heads up as to what it is. Good? Okay. So selected articulations in depth, I'm not going to test you on. Disease and aging of joints. Okay, remember I said whenever we have a system or something like that, aging is always contained in it. Now, aging is medical. Disease is medical. We are learning about how things are supposed to be when things are normal. Hang on. Hang on. Hang on. That's Brooke calling me. I have to take a pause, but I got to get there first. Oh, there we go. Pause. Okay. We were going through the outline. Remember that? I got sidetracked because you guys are taking the exam right now. We talked about fibrous joints, cartilaginous joints. We talked about synovial. We talked about selected articulations. That's different places, and I'll go through all the different ligaments and tendons, but you're not going to be tested on it. And we were right here, disease and aging of joints. When we think, and I've told you guys this already, when we think of human anatomy, lower division, this is the way the body is if everything is working good. We don't talk about diseases. We don't talk about freaky things because that is in upper division and in medical school, okay? So when we say introduction to human anatomy or human anatomy, you're getting the way the body is supposed to be. So what I'm trying to say is I don't do a lot of disease and aging of the joints. I don't do a lot of diseases, even though your textbook has a bunch of them, because you're going to get it later, okay? And there's too much stuff out there to try and conquer in a semester. Aging of joints, I'll talk about that because we talk about the human population living much, much longer, and we're starting to see age-related problems. and you've heard about it, arthritis. Okay, that's one of the huge ones. You have osteoarthritis and rheumatoid arthritis. So I'll talk about those. Got it? All right. Development of the joints is embryology, and we'll not be doing anything with development of joints. Okay, articulation joint. This is bullet number 1. An articulation or a joint is the place where the bone meets another bone, cartilage or teeth. What I'm trying to mean by that is your humerus meets your ulna. That is a joint. Your radius meets your humerus. That is a joint. Your radius and your ulna meet. That is a joint. So wherever they touch, I'm moving back again. Sorry about that. Okay, you see what happens when you're doing stuff live, when you're trying to multitask? Okay, sorry about that. We're probably going to get it happen a bunch more times. This is you taking the lecture exam right now. Okay, so anyway, I was talking about 2 bones touch. That is called a joint or articulation. It can either touch, a bone can touch another bone, a bone can touch cartilage. Example, your rib cage. Your ribs do not touch your sternum. Your ribs go into cartilage. They go into your sternum. That is a cartilaginous joint. So an articulation is where a bone goes into cartilage. You get it? Also, the last weird one is where your teeth go into your mandible, your lower jaw, or your maxillary bone, your upper jaw. When that goes in, that is also called a joint, okay? Even though your teeth are not bone. Good? Okay. Okay, now, this one right here, it says articulations vary in stability and mobility. Okay, remember I said they're classified in how they move and then what holds them together. Remember that? How they move is called function. What holds them together is called structure. Okay. What is the most movable joint in your whole body? Think about it. Look at your body, move it around. What moves the most? My thought would be my fingers. Yeah? It's not. It's your shoulder. Okay? What is the weakest joint in your body? Your shoulder. Do you see? So what that statement says right there, vary in stability and mobility, the more movable your joint, the weaker it is. What's the strongest joint in your body? I thought you're probably thinking, oh, your ankle or your knee or something like that. No. Bones of the skull. Okay? You have 26 bones in your skull, and those things are fused, but they're still separate bones. That means 2 bones meeting is called a joint. So that means that one doesn't move very much, but boy, is it strong. Do you see? So the next thing I'm going to show you when I get up here is I got a graph. Okay? Now most of us freak out on a graph. When you take physiology, which I think is the most difficult course on campus, unless some of the math courses, they're the most difficult course on campus. And it's because there's a lot of reasons, but it's the function of everything we're talking about. But you're going to see that there is a lot of graphs that are used to explain data. And when that happens, we go, oh no, I can't read a graph. I can't do graphs. Let me explain. A graph, when you see a graph, after I tell you this and after you practice it, you should be smiling from ear to ear because you're looking at a picture of the answers. And the answers are usually with data. Do you understand? So if I wanted to say, how fast can an airplane fly in the sky? I would make a graph. I would put speed over time. How fast does it go over time? And there's a graph. All you got to do is read it. Do you understand? Okay. Then sometimes we get more complex with graphs. We try and put 2 or 3 different things on the graph. So what we do is we're taking separate graphs and we're combining them. And that really screws you up. but you just have to pause and attack it the same way. And that's what I'm trying to do right now. I'm letting you peer into how do you read a graph. And if you approach it the same way every time, you're going to find out, oh, that ain't such a bad thing. You're thinking, I know how to read a graph. Well, I teach physiology too. And when I show a graph, that's where I usually lose people. So what I'm trying to do is give you an introduction on how do I look at a graph and what is it telling me. Here we go. Determined by joint structure. The more mobile, the less stable, and vice versa. That's what I was telling about. Your shoulder is the most movable, but it's the least stable. Your skull is the least movable, but it's the most stable. Good, good. Here's the graph. Okay. Relationship between mobility and stability in joints. Okay, now here's this graph. Now don't look at the pictures. I know you're looking at the pictures. Don't look at the pictures. Look at the title. What are you comparing? Your title is always going to tell you what the graph is going to show you in data. Okay, so what is it saying? Relationship between mobility and stability. So I'm going to be looking at two things, mobility and stability, and are they interrelated? Okay, now drop down, but don't look at the picture. Don't look at the picture. I'm going to use my cursor, okay? You see how there's a little bit here and there's a lot over here? That's stability. So what the bottom x-axis thing is telling you is over here, I have very little stability. Over here, I have a lot of stability, and these pictures are going to be examples. Don't look at the pictures, okay? So it's also saying that this is unstable and this is stable. You can tell that two ways. One, it's written for you, and the other thing is the height of this bar. Okay, let's go to the top. Mobility. It's showing you I'm most mobile over here. I can move a lot over here. I can move very little over here, which we call immobile. Okay, you see the thickness? Do you see it? Study it. Pause it. Study it, because this is a more difficult graph, but it's showing you everything you need. So if I'm over here, I'm looking at a very unstable joint. Now go to the top, but it's very mobile. See it? Okay. So what we actually have is two x-axis and y-axis here, y-axis here, y-axis here, y-axis here. You see? So if I could I take this same picture and on one graph do just the bottom one, stability, on the next graph put mobility and have the same pictures? Absolutely right, I could. But what the author wanted to do is compare the two, show the relationship. So he puts them both in one, okay? Maybe save paper or be green thumb so you want to waste a tree or something. Anyway, now look at the pictures. What is that? Okay, that's an arm joint. What is this? This is a skull joint. Okay, so let's take a look at the skull. Is it stable? I don't know, let's look at the graph. Oh yeah, it's very, very stable. Is it very movable? Oh no, it's very immovable. You see? See? Look at the pink, look at the orange or tan. Let's go over here to the arm, the shoulder. Is it very stable? No, not at all. Is it very mobile? Oh, yes. You reading the graph now? Pretty easy, isn't it? And it goes all the way down. Yeah? Wow. So when you see a graph, don't freak out. Okay, now remember I said the classification of joints? How are joints classified? Come on. How many ways? Just give me a number. Just a minute. Multitasking here. Okay. All right. This is when you guys getting back to me. Some of you guys are having little problems with Chrome. Okay, classification of joints. Remember, there was two ways. One was by how much does it move? We said that was function. And the second one is what holds it together. Yes, and we said that was structure. Remember the fibrous, cartilaginous, and the sock, synovial? Okay, so we're going to go into detail on that. Classification by structure. Okay, that's the proper term, not what holds it together, structure. Okay, there's three possibilities. Fibrous, look what it says. Bones held together by dense, regular connective tissue. You even know what that looks like under a microscope. Cartilaginous, bones held together by cartilage. I've already done this on the bullets, huh? And synovial, bones separated by fluid-filled cavity. This is the sock. Okay? Classification by function. Synarthrosis. Now this is, function is how much does it move? So it says immobile joint. Remember that graph? Which one's for most immobile? Non-mobile. Skull, huh? So I always say this in when we do face-to-face. Are we supposed to sin? And the answer is no. So let's try this again. Are you supposed to sin? That's S-I-N. No, you're not supposed to sin. Think of synarthrosis. Arthrosis means movement. It means movement at a joint. Synarthrosis was what? Doesn't move. Or moves very slightly. So a synarthritic joint doesn't move. Example, skull. Good? Good way to remember it, huh? Some of you are still trying to figure out the sin part. The next one is amphi. Amphi means both, which means it does move and it doesn't move. Synarthrosis is a slightly movable joint, like your vertebral column or the pubic symphysis, where your two innominate bones come together. And the last one is diarthrosis, which is a freely movable joint. These are our wrists, our shoulder, our knees, our hips and stuff. That is a diarthritic joint, which means freely movable. Okay, here we go. So we talked about, you look at the top, classification by structure, what holds it together. This one, classification by function, how much does it move? Three ways it can move. A little bit, sin. Yes, no, amphi. Freely movable, die. And then arthrosis follows it in each one. Good, good, here we go. Joint classification. Now what I'm going to do is this, I want you to just look at this. This is a table, okay? Don't panic on this. It says what they're doing here is they're showing you structure classification and functional classification. So the two ways of classifying a joint, they're putting them on one table for you, okay? They're giving you examples of them here, and they're talking about general characteristics and structural characteristics. Do you understand? Okay, do you see fibrous, cartilaginous, and synovial? We already know about those, don't we? Do we see over here syn, amphi, and di? We already know about those. Well, how come syn is here twice, amphi's here once, syn is here, amphi's here? Because the examples that we're using maybe syn arthrosis for fibrous, and then when we look at cartilaginous, we see syn again in a different way. You see? Synarthrosis. Okay? So what we're going to do is, I'm going to go through fibrous, and I'm going to go through these three examples. These are subcategories. Then I'll do cartilaginous, and I'll go through these two subcategories. Then I'll do synovial, and this will have a whole bunch of stuff on it. Do you understand? Okay, here we go. Fibrous joints. Dense regular, CT stands for connective tissue. Okay? Three types, three subcategories. Okay? First one, gomphosis. Gomphosis. What does that sound like? Gums? Gums? Yes? That your teeth are in? Up it. That's what it applies to. Joints between the teeth and the maxilla and mandible. And it's, for function, it's synarthritic. doesn't move. Okay, your teeth aren't supposed to move. Okay, for those of you who had braces, you know that they're not supposed to move, huh? Because just when your teeth are starting to feel better, you got to go back to the orthodontist. He starts cranking on them so you can't sleep for 2 days, huh? Anyway, gomphosis. Next one, sutures. Okay, this is a fibrous joint. Sutures. The skull bones. Are your skull bones supposed to move? No. So it's a synarthritic function. See, this is structure. This is structure. This and this is function. You see? So we're looking on that chart, we're looking on both sides. The next one is syndesmosis. Syndesmosis. Now this one's a little bit weird because you see that word syn, you're going, oh, it's not supposed to move. Nope. Syndesmosis used to be called interosseous. I don't know why they changed it. When it was interosseous, it worked perfect. But somebody put that syn in, and I do that syn thing where you're not supposed to syn. You're thinking, oh, it's not supposed to. Okay? But this is just kind of a little bit of a freak. I'll explain it in a minute. It says joints between parallel bones in the forearm and the leg. Radius and ulna, radius on the thumb side, ulna on the little finger side. You have two bones right here, radius and ulna, and they're parallel to one another. Down in your leg, you have the tibia and the fibula, and they parallel each other. And there's some dense regular tissue in between them, kind of like a bed sheet. Because you think about it this way, when you move, you turn your arm like this, you turn your arm or you put pressure on it, the bones are going to want to explode out laterally. So what keeps it there is tissue. Okay, what kind of tissue? Dense regular. Okay, and that's called a syndesmosis joint. Does your wrist move and does your lower leg move? Yeah, a lot. No, a little bit. That's amphiarthrosis. So it's an amphiarthritic joint as far as an amphiarthritic joint as far as movement, which we call function, but it's a syndesmosis as far as what holds it together. Got it? Okay. Pictures. Remember I said we do dialogue first, then we do pictures after that. Okay? If I do pictures, images, kind of reinforces it, and then I put it in a table. This one I put the table before. Okay? Anyway, fibrous joints. Here we go. Here's the three classification. Gomphosis, suture, syndesmosis. Okay, gomphosis, gum, teacher. You see these little things right here? Okay, those are periodontial ligaments. That's what holds the tooth in that socket. Got it? And that, what is that periodontial ligament made out of? Dense regular. Yeah, dense regular. Here's the suture. Okay, what you don't see is there's tissue, dense regular, around this joint holding it in place. Okay, that's a suture. Now, here's your ulna, and this is your radius. Do you see this right here? That's dense regular. That's a syndesmosis joint. There's interosseous. Used to be called interosseous. Now they said syndesmosis. Okay, make sure you know both names because I'll use both names. Okay, they call this an interosseous membrane, syndesmosis membrane classification. You get it? Okay. Cartilaginous joint, second classification, structure. It says bones attached by cartilage. Duh. Okay, two types. Synchondrosis. Now take this apart. What does syn mean? No. What does chondro mean? Cartilage. Joint, osis. Okay? A non-movable cartilage joint. Hey. Bones held together by hyaline cartilage. And obviously they're synarthritic. Give me an example, Daddy. The ribs connect to your sternum by way of cartilage. It doesn't move. You're saying, yes, it does. My chest expands and contracts. No, that's flexing. It's not moving, it's flexing. Do you understand? Synchondrosis is one type of cartilaginous joint. Symphysis is the other type. Okay, now look what we see here, fibrocartilage. We saw hyaline up here, we see fibro here. Elastic doesn't play a factor in this. Fibrocartilage, where do we find it? Where the two innominate bones came together, in the pubis. We also found it in the vertebral discs. That's what's a fibrocartilage. We also find it down in the knee. It's called a meniscus. Yes? Okay. Symphysis. When two bones are held together by fibrous cartilage, it's called symphysis. Does it move? Does your pelvis move? You're going, no, you're wrong. It does. It moves a little bit. Ladies, when you're having a big 10-pound kid, you better believe it's going to move. Okay? So that's called a symphysis. If it's in the pubic is called pubic symphysis. See how the name works? If it's in your back, it's called a disc. Okay? All right. Cartilaginous joints. Here's where you find them. Now, this is hyaline cartilage, and we call it costal cartilage because it's holding a rib, which is called a costal, to the sternum. See that? So that joint right there and that joint right there are called synchondrosis. Okay? And it is synarthritic. It doesn't move. Got it? Also, this is kind of a weird one. When you are born, about 95% of your skeleton is hyaline cartilage. That's so you can get out that little hole down there at the bottom. Once you are born, you start to ossify in different places, starting with your skull, your collarbone, your clavicle, and stuff like that. Anyway, the last thing that ossifies, turns into bone, is the growth plate. And that's what that's showing you. So here's the head of your bone. Okay, this is a humerus, but it doesn't make any difference. This is the head of your bone. Here's the shaft of your bone. The two are connected by cartilage. You see that? Okay, and it's not supposed to move, man. So we call that a synchondritic joint. Okay, now in adults, this cartilage is all gone and it's all bone. And we'll learn about that in cartilage to bone. Down here is a synovial joint that's amphiarthritic. Okay, down here is pubic symphysis, all fibrocartilage, and here's your disc. Good? All right. Synovial joints, third type. This is the one that has the sock. Now in lecture, what I usually do when we have contact is I bring in two bones. I bring in a femur and I bring in a tibia. And I say, look it, and I drop them on the ground. They just fall apart. And I put them in a sock. I've cut one of my very treasured socks off, a foot. And I have just the shaft that goes over my ankle and my leg. And I take that in and I put that bones in there. And I throw a little piece of tape around each end and they flop around, but they don't come apart. Okay? Then I take tape and I wrap it like a ligament. And all of a sudden that joint is starting to get more and more rigid. Okay? And that's what happens in a synovial joint. We're going to go over that right now. They're freely movable. Now you see how it says diarthrosis? You're thinking, well, wait. Diarthrosis means it is freely movable. Freely movable synovial joints. I don't get it. Synovial is a structure. What holds it together is a sock. Okay? It's called an articular capsule, but I'm going to get to that. Is it freely movable? Yes. What's another name for freely movable? Diarthrosis. Well, is that the same thing as a synovial joint? No, it's not. Well, then why do they always put it together? Answer, because the only synovial joint is diarthritic. The only diarthritic joint is synovial. Get it? They're not the same, but they have the same components, if you will. Okay. Articulating bones are separated by a joint cavity. Got it? Your elbow, your wrist, your carpals, your knee, your hips, your ankles, all those things are a synovial joint by function, held together by a sock, and they're diarthritic, they're freely movable. And there is a cavity in there. What do you think we're going to put in that cavity? Think, air? No. You want something that's very slippery. Yeah? You want something very slippery. Think of a car engine. Yeah? You know, you're going 100 miles an hour down the road being chased by the cops. How come your car just doesn't seize up? Because all the parts are moving, and they're moving really fast. How come they don't do it? Because you have oil in there, and oil is a lubricant. And the only way that you can have oil in there to be a lubricant is you have to have a cavity. Otherwise, oil couldn't get in there. You get it? Same thing. Elbow. I'll just use the elbow as an example. That is a synovial joint. It's diarthritic. There's a capsule, a sock that goes around my humerus and my radius and ulna goes around it. What am I going to put in there? Oil. What is the oil called in the human body? Synovial fluid. We talked about that. Synovial fluid. Yeah. So that keeps it lubed up. Well, what happens if that synovial fluid starts to crystallize for some reason because I was a sinner or something? What happens? Rheumatoid arthritis. Yeah. Wow. What happens if I injure the joint and I start producing more fluid? What is that condition? Fluid on the joint. You've heard it as water on the elbow or water on the knee. It ain't water, Jacko. It's synovial fluid. Okay. General anatomy. Okay, I keep calling it a sock. Now we're going to get down to technical terms. Not a sock. It's an articular capsule. Okay, an articular capsule. And that capsule, because think of it as a sock, there's an outside and an inside lining to your sock in there. There's going to be an outside and an inside lining to this articular capsule. Well, there's the word, articular capsule, sock. There's a joint cavity. We already talked about that. There's synovial fluid. That's the oil. Articular cartilage. Now, if bone is very porous, okay? So if you want to do a little experiment, the next time you go to KFC, Kentucky Fried, and you're done with the leg bone, okay, your drumstick, which is the lower leg bone, tibia, or the upper one, which is the thigh, get all the meat off it, and you'll see there's like a little paper on there, okay? That's the periosteum. Get that off, and then rub the bones together. You're going to find out you can turn them into dust. So that means bones are very porous. And if we were to walk, had a freely movable joint, it wouldn't take very long before we didn't have a bone and we were dust. Yeah? So what are we going to do? We're going to put another substance around the ends of the bone, and we're going to call that substance cartilage. It's hyaline cartilage. But since it goes around the ends of the bone, we call it articular cartilage, even though it's hyaline. And that is really smooth. Okay, a little experiment. You're going to barbecue some chicken quarters, right? A chicken quarter is a thigh and a leg. If you take and cut the meat off, cut the muscle off, you're going to end up with two bones, and on the end, it's going to look like it's kind of silvery. Now, this is before you cook it, a little silvery. Take those bones and rub them together. See if you can sand those down into dust. I can guarantee you cannot, because that ends of those bones are covered by cartilage, hyaline cartilage, and we call it articular cartilage, and it's super, super, super smooth. Okay, and that's what keeps our bones from turning into dust. Well, what happens if we lose that articular cartilage? Osteoarthritis. Yeah. Okay, osteoarthritis. There's no articular cartilage, and that's how you get deformed joints, and they hurt like a son of a gun because there's no slipping. Yeah, I told you about aging now. Ligaments. Remember I said that in the class I wrapped a piece of tape around each end of the sock, and it was kind of flopping around, and then I started winding it back and forth across that joint, and I said that was to mimic a ligament, and then it got real firm, huh? Okay, that's what ligaments are for. Ligaments, bone to bone, dense regular. I can't read this. I want to move this a little bit. I don't know if you guys can see this thing. It might be just me. Move it up to the top. Nerves and blood vessels. How does a nerve strengthen a joint? Okay. Take your thumb, start bending it back. What happens when you get it bent back as far as it can go? It starts hurting, doesn't it? You keep going, it starts hurting more. And when it starts hurting more, what does that joint tell your brain? Stop. That's what a nerve is for. A nerve is so you don't overextend or you don't overdo whatever to that joint. okay? Protects and strengthens that joint by telling you don't do that. All right, let's go to something else. I move that off. What's the next thing? Oh, let's take a look at a joint. Okay, there's the articular capsule. Remember? Now what I'm doing is taking those other ones, we're talking about them again. And the articular capsule is your sock. Has an outside, has an inside. The outside, called fibrous. The fibrous layer, outside layer, fibrous layer. Inside layer, synovial. I'll bet you know what that synovial does now too, don't you? Okay? I bet you went, I'll bet you that produces the synovial fluid. And man, you go right to the head of the class. That is exactly right. Okay? All righty. All righty. So the outside of the sock, fibrous. Inside, synovial. What does the outside do? Protection. What's the inside do? Produces the fluid. Good, good, good. Oh, wait. It says right there, secretes fluid. Okay, how about a picture? Whoops, no. I'm going to go through some more words. Articular cartilage. Oh, I'm going through each one of those things. Okay, so I did the articular capsule. I did the fluid. Now I'm talking about that cartilage. Yeah, that cartilage is absolutely a paramount importance in a synovial joint because it keeps the bone from grinding down to dust. Okay, it makes it slippery. And we know one of the diseases is arthritis. And osteoarthritis is when the articular cartilage, for some reason, stops being rebuilt and you end up bone against bone. Okay? So it says reduces friction, shock absorber. Then you have the joint cavity. Okay? So not only do you have articular cartilage and you have a sock or a articular capsule around there, you fill it up with oil. And the oil is called synovial fluid produced by the synovial membrane. Yeah? Okay. Okay. Joint cavity space between the articulating bones contains synovial fluid. What happens if you have too much synovial fluid? Your skin stretches out and you look really goofy. Yeah? Okay. I had one on my wrist and it was called, just a minute, I know this. I'll come back to it. They finally had to drain it. Okay, I haven't had one on my elbow. I haven't had one on my knee. Maybe some of you have. And they call it tennis elbow or water on the knee. All that is the joint's been traumatized and they produce extra fluid. Yeah, almost had my wrist. Darn it. It'll come to me. Then I'll shout it out. Lubricates, nourishes the chondrocytes of the articular cartilage. Duh. Okay, that's the cartilage cell. Okay. The shock absorber. Okay, that's what that fluid does. Okay, now we're thinking, oh no, ligaments. Remember bone to bone? I said I wrap that thing. Ligaments are bone to bone. Tendons are muscle to bone. Look at that, dense, regular. You know what that is. Strengthens and reinforces the capsule. Nerves, I told you how that works. Detects pain. So you don't overstretch that joint, tear it. Blood vessels, nourish it. They give a little bit of support. Their biggest thing is bring nutrients. Yeah, yeah. Okay, now picture. There we go. Okay, let's put all these things together. I know you're looking at it and go, wow, look at that, look at it. Don't look at that. Watch me, and I'll take you all the way through this. Here's that sock. Here's that sock. And it's called an articular capsule. You see it over here? Articular capsule. The outside is called fibrous. And what they did is they painted the inside purple for you. So you know that was the synovial. So fibrous, synovial make up the articular capsule. Here's the joint cavity. What do you put in that joint cavity? Fluid. Yeah? What kind of fluid? Serous or synovial fluid. Okay? Serous or synovial fluid from the synovial membrane. It fills that up. You see this kind of grayish silver thing right here? Guess what that is? That's your articular cartilage. Hyaline cartilage, articular cartilage. Remember that one we showed with we were talking about cartilage to bone? And we said it was synarthrosis, and I said where the head of the bone, just a minute, I gotta find it, the head of the bone and the shaft of the bone meet. I said it was the growth plate, and I said, but when we get older into our late teens and stuff, it's all completely ossified. Here's one that's completely ossified. That's not called a growth plate anymore. It's called a growth line. Growth line. And here's the other one. This is smooth bone. Smooth bone. I mean, spongy bone. We know that. We saw that. And the other part that you don't see all this matrix. This is the compact bone. This in your bones, they got a hollow inside. Oh, I gotta go. I gotta go. Coming back. Okay, we were talking about the structure, this picture here, and I got right to here, and I had to go somewhere, and now I'm back again. So let's take a look at this. We already did what the synovial, the sock joint was. We talked about the articular cartilage, which is hyaline cartilage. We talked about the cavity, it's full of synovial fluid. We talk about the growth line versus a growth plate. This is spongy bone. This is compact bone. And I was telling you that your long bones are hollow inside. And this is not going good. Okay, let's try this again. We talked about this sock. Ah, dang it. We talked about this sock, which is called articular capsule. We know there's an outside and an inside. There it is, articular capsule. The outside is the fibrous, the inside synovial. That's this purple synovial. It produces synovial fluid. Okay, and we were talking about tennis elbow and water on a knee and all that other stuff. This is called a ganglion cyst. I just remembered it. Okay, so when if you have a ganglion cyst, what it is, it's just the articular capsule popping up above the muscle and underneath your skin. It looks like just a big pouch sitting there. Okay, and you can get it for a bunch of different reasons. Okay, anyway, so that just means it's full of fluid. Okay, and then we talked about, and this is, I said I keep getting to this point when the phone ding goes off. This is a long bone, and it's hollow in the middle. And the hollow part is called medullary cavity. Medullary cavity. And what the body does is it stores fat in there. Okay, because the bone cells need potential energy, which is fat, and the muscles, which are wrapped around the bones, need it. So there's a good place to store it. And we don't call it fat when it's in a bone. We call it yellow bone marrow. Huh, how about that? This is red bone marrow. This is yellow bone marrow. Pretty cool, huh? Let's go to the next slide. What do we have here? Okay, it talks about you want to reduce friction. You're going to do that by cartilaginous, articular cartilage and the fluid. Oh, yeah. Let me think if I give you an example of this. You're laying in bed. I don't know if this is going to work out right. You're laying in bed. You can't move. You can't get comfortable. What's the thing that you move? Try and get comfort. Beside your body. You move the pillow, don't you? Because the pillow will give you some relief from pressure. Huh. Okay. In a synovial joint, you have tendons constricting, muscles moving, and you have movement across that joint. Yes, do you have an articular capsule? Yes. Do you have synovial fluid? Yes. Does that help? Yes. What about some joints like the knee joint that really takes a beating? Is there some way that we can even give it a little extra cushion? And the answer is yes. We fill it with little pillows. And the pillows are full of synovial fluid. Those little pillows, we stuff them in the joint. We stuff them between the ligaments. We stuff them between the tendons. And those are called bursa. Bursa. Sacs around and about the synovial joint, where ligaments, muscles, tendons rub. Contain synovial fluid. Pretty good, huh? Yeah? What about if that crystallizes? Let's say that fluid, which is supposed to be nice and soft and cushy, what about if it starts to crystallize? In other words, almost getting solid. Okay? You ever had a rock in your shoe? Can you ignore it? No. Can you still function? A little bit. Okay, that rock is a crystallized bursa. And what we call the condition is bursitis. Bursitis is when that pillow becomes hard. And then the only way you can do it, you can't inject something in it, turn it back to liquid, out it goes. And then the pain goes away. Are you just as good as normal? No, because you don't have that extra cushion. Okay, so you're gonna get irritated, you're getting inflammation. Good? Now, in our wrist and hand, metacarpals, the palm of your hand, and the same thing in your foot, we have long, long tendons. The muscles for my hand are up here in my forearm, and they go all the way down to my fingers. That means they have to be covered by a bursa, okay? But bursa are little pillows. What about if we stretch one of those pillows out? Does it change the name? The answer is yes. Does it change the function? No, it doesn't. Just changes the name because it's longer. Elongated bursa is called a tendon sheath. Elongated bursa. It's on your exam. Okay, good, good. Okay. I'm going to show you a picture of it. In fat pads, in A&P, we do a dissection of a chicken leg quarter, the thigh and the lower leg. It's called the drumstick. And one of the things we do is when we break that joint apart, there's some yellow, soft, cushy stuff in there, and it's fat. Why is fat stored there? This time not for energy, this time for cushion. Yeah? Cushion for the cushion. I crack myself up. Fat pad gives you cushion. That means it protects that joint a little bit, doesn't it? Okay? Okay. What else we have? Burst intended, pictures. Okay, let me show you what you got here. Here's the tendon. Here's fat. Here's the tendon of a muscle. Here's your patella, your kneecap. These little blue things right here, 1, 2, 3, those represent pillows. Now, when they made this drawing, they didn't do it right. Also, by the way, the yellow bone marrow is missing here, okay? What they should have done is instead of cutting it like this, they should have turned it this way so you could see the pillow. What they did is cut it so it almost looks like a little finger sticking in there, and it's not, okay? It's like a pillow. And then, now what they did is cut it away here, okay? But this is your tendon sheath. See, it's cut away here too. See how long that is? Okay? Because you got to figure in your hand and in your toes, man, those things are moving all the time and they're rubbing right against each other. You don't want that because it's going to cause irritation. So what you're going to do is you're going to put them in a protective sheath that you can fill up with synovial fluid. Understand? Tendon sheath, bursa. Okay. Now, how many types of synovial joints are there? One. It is a diarthritic joint. Okay? But since we have them throughout our body and some of them move more than others and they move in different directions, we subdivide that. Okay? So here we go. This one gets tricky. You need to put this in a flow chart. You know how you did for connective tissue, you put it in a flow chart? You need to do this for this. And go on SI, and Brooke will have one for you, or go to Sarah and she'll have it for you. She'll show you, because I showed them. Okay? You want to put this in a flow chart. It's the only way you're going to remember this thing, because it subdivides in 3 different ways. Okay, you're going to see uniaxial, biaxial, multiaxial. Oh, that's only 3. Yeah, but then you're going to see gliding and saddle joints, and it goes on and on and on. Okay? So I'm going to show you that, but you want to put it in a flow chart so you can memorize it. Anyway, they're synovial joints classified by the shapes of articulating surfaces and the amount of movement. 3 planes. Remember what a plane was? Okay, like a piece of paper is a plane. Okay, there's 3 planes of movement. If it only moves one way, it's called uniaxial. If it moves 2 ways, it is called biaxial. If it moves in more than 2, so 3 or more, moves in 3 or more, it's called multiaxial. And we have examples of those. Elbow, watch your elbow. That's the only thing that ulna can do. can only go this way. It doesn't do this. That's the radius that does that. It does this. Okay? Uniaxial. Got it? Okay. Okay. I'm going to show you more of those. Okay, now there was 3 planes of movement, uni, bi, multi. There's 6 classes of joints, of synovial joints. So now we're talking about planes, now we're talking about classes of. Here they are. Plane joints, hinge joints, elbow hinge joints, pivot joints. Okay, pivots. Those are all uniaxial. Got that? Those three that you are seeing right there are uniaxial. So under uniaxial, you put 3 examples. You see how that flow chart's going to go? Biaxial, there are 2, condylar and saddle joints. You see that on your fingers and in your carpals and tarsals. And then there's only one type of multiaxial. That's called ball and socket. Your hip. Pretty good. Your shoulder. Humerus. Get it? So 1, 2, and 3, uniaxial. 4 and 5, biaxial. 6, multiaxial. Are we good? Okay. You're never going to remember this, but if you look on the notes, I have examples of each. Okay. Okay. This is in your exam. What they're showing you is a plane joint. Okay, a plane joint, and they're talking about the carpal bones. Okay. They talk about a saddle joint and a condylar joint, which go to the thumb. They're talking about multiaxial ball and socket, which is your hip, your hip where your femur goes in. And when you see these things here, 1, 2, 3, 4, 5, 6, that's trying to show you if you built something out of metal, that's what it would look like. Okay, a pivot joint. See what it's trying to show you is it goes like this, like this. What you say to drugs? No drugs. Okay. They talk about a condylar joint. Okay, that's this one. They talk about a saddle joint. That's one that kind of, you sit in a saddle and you kind of go like this. That's a saddle joint. We see that in your fingers. And a plane joint, capillaries, your tarsals and carpals, and a hinge joint. Good, good. So on exam, I'm going to ask you, hey, the femur going into the acetabulum of the hip, what kind of joint? What class of joint? Ball and socket. Good? Now, remember we had planes, we had classes, planes of joint, there's 3, uni, bi, multi. We had classes, there were 6. Remember pivot, hinge, all those things. Now we have movements. Now here's the 3rd one of synovial. 4 types: gliding, angular, gliding, rotation, what you say to drugs, and special. Those are the oddball ones, mostly the thumb. Okay, special movements. So now let's review this because you're putting this in a flow chart. And Brooke will help you with this because I taught her and I taught Sarah too. You have 3 planes under synovial joints, 3 planes of movement, uni, bi, and multi. You have 6 classes of movement. You have 4 types of motion. Motion's the big word. And I'm going to ask you this on the exam. There they are. Which is not a type of motion? Gliding, angular, rotation, special, and condylar. Okay? Condylar is class, not a type of motion. Okay, remember those movements we did? Remember those movements where we had Bubba and Bubba's sister and the grandmother and all that stuff? That's what this is. Flexion, and it tells you a definition. We did all those. I did them with pictures. Remember I said we were going to revisit it? Okay. Gliding motion. Back and forth, side to side. Okay. Now, remember there's 4 groups of motion. Gliding was the first one. Back and forth, side to side. Oh, Daddy, where do we see it? Angle between the bones does not change. So when we do this, that angle changes. When we do this, that angle changes. We're not changing the angle. Okay, we're just talking about moving on the surface. Mainly the plane joints. Okay, gliding motion, plane joints, uniaxial. Carpals and tarsals. Carpals are your wrist, tarsals are your ankle. Angular motion increases or decreases the angle between the bones. Duh. Flexion, extension, hyperextension. We good? We good? Brooke's telling me something. Okay. We got a little panic because it looked like only 30 people were taking the exam, but there's actually 87, so we're good. Good. Good, good. Yeah, you guys are doing good. Okay. Flexion is an angular motion. Extension is an angular motion. I gave you definition of these, so I'm not going to go over them again. Hyperextension. Remember, Bubba? Flexion, extension, hyperextension. Watch, watch, watch. Flexion, extension, hyperextension. Good. Flexion, extension, no hyperextension. Remember those? Okay. And lateral flexion is when you bend at the hips. Remember that? Remember Bubba's sister? She was bending at the hips. Okay, that's lateral flexion when you go from side to side. Abduction. Now, the next 3 you're going to see the suffix duction. Duction. Abduction. Increasing the angle. Watch. Abduction. Adduction. Circumduction. Get it? So abduction, move away from the midpoint. Adduction, move back to the midpoint. Circumduction, work around the midpoint. Remember they had Bubba's sister and she was taking her leg and going around a point. You can do the same thing with your arm. You can do the same thing with your finger. Okay? That motion is circumduction. Are we good? Okay. Okay. Remember these pictures? Remember these pictures? We already saw them. I'm going to run through them real quickly. It doesn't mean that you're not responsible. It means you're responsible for them again. Okay? Extension, flexion, hyperextension, lateral flexion. There's Bubba's sister. Remember, she's bending at the waist. She's bending at the waist. That's the lateral flexion right there. Abduction, adduction. Okay, there's grandma moving away. See the ab is to move away from the midline. Ad is to move towards the midline. Okay, a little deceiving. Here's the leg. It's easier to see. Ab is to move away. Ad is to move towards the midline. Good. We can do it with our hands too. Okay, I was doing it with my hands, showing you with my fingers because it was easy. Circumduction, remember that we have duction. This is moving around the point, moving around the midline, moving around that point. And rotation. Okay, rotation. What do you say? What do you say to drugs? No, that's rotation. Okay, I think we got grammar on this one. Atlantoaxial joint. Your neck vertebra are called cervical vertebra. The very first one has a special name. Okay, it's called the atlas because it rests. The head rests on the atlas. The second one has a special name. It's called the axis. So what happens is, here's your axis, here's your atlas, and it does this. The atlas doesn't move. It's attached to the head, so it moves on that. And that joint is called the atlantoaxial joint, and it pivots on that. There's a little thing that sticks up called the dens or odontoid process. And that's what gives you this. No, I do not want to do that. Limbs turning from medial, lateral rotation, medial rotation, pronation. Okay? Anatomical position, you can't see me right now. Maybe back up. Let me see if I can back up. Anatomical position, my hand is like this at my sides. Okay? So when I do this, flip my hand over. So my thumb, my palms are pointing backwards. That is called pronation. And what's actually happening is my radius, which is on the thumb side, is crossing over my ulna. My ulna is not moving. The radius goes like this. So it pronates, supinates, pronates, supinates. That's a rotation. And if you watch the video I did on the introduction to the skeletal system, I showed you the round head on the radius, how it got its name. And that pivots in the radial notch. Pronation, supination. So here's some pictures. See grandma saying no? Rotation. There's lateral rotation, medial rotation. Taking your arm, going out the side, bring it back. Okay? You can also do it with your legs. And there's pronation, supination. The pronation, supination is hard to see in the picture, so that's why I got to do it for you. Special movements. Depression, elevation. Remember we did Obama? Okay? Depression when shoulders go down, elevation when they come up. And when you're tense, your shoulders come up because you're tense. Yeah? Think of a poor dentist always having their arms up. Dorsiflexion, plantar flexion, that's your foot. Your foot does not extend, it only flexes. So it's shortening on either side. Okay, this way it's called plantar flexion, this way it's called dorsiflexion. So if this is my foot and I do this, that is called dorsiflexion. When I push off to walk, it's called plantar flexion. That's a special movement. Inversion, eversion, when I want to look at the bottom of my foot and I look at my instep, that's the inside, and I go like this, that is called inversion. When I turn it and look the other way, it's called eversion. Okay. Protraction, retraction. Remember Bubba? When you got your jaw sticking out like that, that is called protraction. When you got an overbite, okay, that's called retraction. Opposition. Remember the Boy Scout law? When the only thing in your whole body that can oppose the other ones is our thumb. Huge evolutionary advantage because we can grip things. We can grip things. Okay? Only us and the primates can do that. And that makes us allowed to turn a doorknob, do all kinds of stuff like that. Opposition. Okay? Opposition. Boy Scout law. Okay? Boy Scout is helpful, friendly, courteous, kind, obedient, cheerful, thrifty, brave, clean, and reverent. Yeah, I was a Boy Scout. Yep. Okay, here's depression. He doesn't look like Obama anymore. Poor guy got gray hair all over the place. There's inversion, instep, eversion, looking at the outside towards your little toe. There's protraction, okay, underbite, retraction, overbite. There's the Boy Scout, okay, opposition, and then dorsiflexion, plantar flexion on a foot. These are movements. Okay, remember I said I was going to show you select joints, diarthritic joints, and I was going to talk about what is the name of the articular capsule, what is the name of the ligaments, what is the name of the tendons. Remember that? And I said the first one I do is TMJ. I'll buzz through a couple of the other ones. I won't give you any names. You're not responsible for any of them. But I guarantee you, if you're going to physical therapy, you're going to know these. You're going to know these, like your first, middle, and last name. Good? Okay. Here's an example. Temporomandibular, this is how they do the joints. Temporal bone, okay, back here, temporal bone. Mandibular joint, PMJ. Your disc in your back intervertebral articulations. You get it? They usually use the names. Anyway, here's some of the names, and here's where you find them. Okay. Okay, here's the one I was going to talk about, temporomandibular joint. It's a diarthritic hinge joint. Yeah. Diarthritic hinge joint. It involves the mandibular condyle and the temporal bone. You have an articular disc, a little bit of fibrocartilage in there, like a meniscus. Yeah? Because, man, when you're chewing, you are exerting a lot of power there. Ligaments. We're going to name a bunch of them. Now, the way they name the ligaments, the sphenoid bone, the mandibular bone. The ligament that connects the sphenoid bone, which looks like a butterfly, it goes behind your eyes, and the mandible, which is your lower jaw, is called the sphenomandibular ligament. Okay? Not a big deal. Stylomandibular. Remember, a point on a bone is called a styloid. Kind of up on that. If you take your tongue and put it all the way to the back of your mouth and over to the side, and you could pop a hole right through the roof, go right over to the corner, there's a little piece of bone that sticks down. It's called the styloid. Okay, styloid bone. So there's a ligament that goes from there to the mandible. It's called the stylomandibular ligament. One from the temporal bone to the mandibular bone. There's one on the lateral side. It's called temporomandibular lateral. Okay, picture. Okay, here's the styloid process. See, I had you put your tongue right back in here. Okay. There's the styloid process. There's the stylomandibular ligament. Here, this one goes from the temporal bone to the mandible. This is the temporomandibular ligament. This shows articular capsule. So this looks like another ligament, but it's a whole capsule that goes around. Here's one in the back, the sphenomandibular ligament. It kind of shows you it's coming from the back side. Here's that it's like a meniscus. There's that articular pad of cartilage, fibrocartilage, and there's the articular cartilage. This is showing the mandible, and then this is filled with fluid. You see, so that's what holds that joint in there. Yeah. Okay. Now here's one in your vertebral column, intervertebral articulations. Okay. Got it? Intervertebral disc, It has all these things. Look at all of these. Okay. And this is what it looks like with all those ligaments wrapped around there in your vertebral column. And there's the disc, fibrocartilage. Okay, I'm gonna buzz through it. I'm gonna get to your shoulder. Okay, this is your lower leg. Nope. Sternoclavicle. This is your clavicle and your sternum coming together. I don't want that one. This is the acromial process where your clavicle comes up the other end. Okay, here's the one. The glenohumeral joint. This is where your humerus comes into your scapula. Rotator cuff. You see it? Rotator cuff, not cup. Rotator cuff. Look at all the bursa. Remember? Why does this have so much stuff in it? Oh, most movable joint in the body. Look at all this. Yeah, look at the bursa. Okay, there's the tendon sheath. You see to me? Are we good? We good? Okay. I'm going to buzz through this because remember at the end I want to talk about something. It's not coming to me. Arthritis. Okay. Anyway, these are here. We're not going to test you on them, but they're here in case you're interested, or later down the road when you're further your education, you're going to be learning these things. Okay. A lot of sports injuries on this. I'm working. Joints of the foot. Oh, I didn't put them on there. Okay, I told you what they were. Arthritis, 2 types. Rheumatoid arthritis, when that synovial fluid starts to crystallize, get hard. Rheumatoid arthritis screws up the joint, hurts. can't move it. Osteoarthritis is the articular cartilage starts to decompose. It ends up being bone against bone. Okay, I'm gonna put this one up here so you guys can see it today. And then I'm gonna get on the cartilage to bone for you. So I'm gonna sign off on this. See ya. Hope you did well on the exam.